죽었고.
But that area that is just pointed out has been sunken. So we're going to fill in the area using fillers.
여기 좀 가라앉았고. 그다음에 여기도 조금 가라앉았고.
Overall, we're going to use the PDO thread to give that immediate lifting effect.
실로는 이렇게. 이렇게. 네. 이렇게 놓고. 시간은 한 20분 정도? 일단 턱 살짝만 들어보세요. 그렇지.
So we're going to anesthetic injections.
제가 좀 끼고 턱 한번 들어보세요. 팔짝. 조금만 이쪽으로. 아니, 됐어. 여기는 괜찮고 턱 한번 들어보세요. 네. 이거 좀 꺼겠네요. 매부리 코가 조금 있어서 코 같이 살짝.
So the patient looks like she has a little crooked nose. I'm going to do anesthesia inside her nose. I'm going to put in the filler to kind of alleviate that crooked nose. He's using the needle to punch the area that he's at the point of injection.
턱 한번 들어보세요. 오늘은 베가페로 필러를 합니다.
Today we'll be working with the Bellotero fillers.
이쪽에 조금 꺼진 그 인디아 밴드 쪽.
So using the injection in the Indian band area where the area appears to be sunken. So the sunken area at the point that he's pointing, that's the Indian band area. And he's using the filler to make the area more voluminous.
항상 충혈을 할 때 압력이 세지 않게.
You have to always be cautious that when you're inserting the filler, when you're making the injection, you don't put too much pressure on it. Ease the injection to patients.
관절은 그 네 번째 층이나 두 번째 층에 넣으면 됩니다.
The area of injection at the moment, which is the temporal area, it's best to insert in the fourth layer and second layer of the dermis.
대부분은 다 두 번째 층.
Most doctors you'll see would insert it in the second layer.
시작. 이쪽으로 좀 가봐요. 네, 그렇게 아프진 않죠? 네, 괜찮아요. 네. 펠로페로 킬러가 모노페이직으로 부드럽게 잘 들어요.
Belotero, the filler that he's working with right now is a monophasic filler, and it goes in smoothly compared to other fillers.
저는 이제 개인적으로 그 필러가 뻑뻑한 걸 쓰면 사고가 잘 나요.
Personally, Dr. Ro feels that if the filler injection feels stiff, that's when a lot of medical accidents happen. So he prefers to use monophasic fillers, which goes in smoother compared to others. Now Dr. Ro is preparing to improve the crooked nose area before the actual injection, using the punching needle at the point of injection. So for the nose, it's better to have a high viscosity fillers.
입자가 좀 커서 뻑뻑한 거.
Because the viscosity is higher and more heavier, it feels a little more stiffer.
지금 코를 하는데 끝에만 마취하고 여기는 안 했어요, 마취를.
So in the anesthesia, he only made the anesthesia at the tip of the nose instead of the rest of the bridge of the nose. Only the tip of the nose is necessary for anesthesia.
지금 코 아파요? 별로 안 아프죠? 지방층은 그렇게 통증이 없기 때문에 마취가 더 할 수가 있어요.
So the area of injection at the moment is at the fat layer. The fat layer, it's not very painful, so it's best not to do the whole anesthesia. Just at the the tip of the nose is necessary.
물김을 조금 하고요.
And after the injection, putting pressure to form that shape of the bridge of the nose.
코 쪽도 보통 두 번째 층이나 네 번째 층에 듣습니다.
Even the nose, the best point of injection would be either second layer or the fourth layer.
네 번째 층은 이제 나사마우스를 가리키고 잘 찍는다. 그리고 그쪽은 한 번에 양을 많이 주사하면 위험할 수가 있고 그래서 소량씩.
Rather than putting in large amount of injections in the nose area, it's best to put small injections at a time.
필러할 때 가장 위험한 부위가 코예요.
the most important area that you should be cautious of when doing the filler procedure is the nose. That's where the nerves. You should be careful.
그래서 왼손으로 그 동맥 부위를 압박하면서 주사하는 게 좋아요.
So you should always hold onto the nose bridge with your left hand as the injection is being made.
동맥은 여기 위치에서 나오죠.
The artery is at the point that he's pointing right now. That is where the artery is, and that's where you should be avoiding. That's why when making the injection, he's putting pressure with his left hand on the bridge in order to prevent from hitting the artery.
지금 볼을 보니까 여기가 조금 적어서 여기 조금 넣을게요.
So if you look at the face, the left cheek feels a little more voluminous, the right feels a little sunken. So add a little more volume to the right side.
눈볼이 조금 더 살짝 들어갔어요. 지금 아팠나요? 지금 조금 지금 요 부위가 마취는 안 한 부위였는데 그렇게 통증이 심하지 않죠.
Even the cheek area that he just injected in, that wasn't an area where he did an anesthetic injection. Even so, the patient didn't feel so much pain.
그렇지 않죠?
See that this area that he's about to inject, it's sunken. Using the filler to fill in the area of the sunken area to give it a little more voluminous look.
오케이, 됐습니다. 그 다음에 이제 시를 조금 볼까요? 뒤로 기대면 돼요. 조금만 내려보세요.
Using a designing pen to draw an overlay of the area, the point of injection for the threads. We're going to be moving on to the threads. As we've been mentioning multiple times, when you're performing filler or thread sessions, Dr. Rowe prefers to do the procedure in a vertical position, sitting down. A lot of doctors, they may do the procedures while lying down, but you get the most natural results when you're sitting down in a vertical position.
귀하고 어느 정도? 이렇게. 네, 오케이. 뒤로 기대시고 턱 한번 들어보세요. 간단해? 편안하게 그냥 딴 생각하세요. 간단해. 거의 다 했어요 이제. 그거는 다 맞추. 조금 했어요. 어지러워요? 자, 좀 어지러우면 쉬었다. 네, 뒤로 기대보세요. 조금 편하게 해보세요.
So the patient is feeling a little dizziness. So we're in a laying down position.
긴장하려면은 4명 중에 1명 정도 좀 어지러울 수가 있어요.
The patients get a little anxious or nervous for the procedure. Maybe 1 out of 10 patients may experience this kind of dizziness. When this happens, it's best to have them lay down.
베이스밸브를 싱크라고 하고.
as Dr. Rowe mentioned, this happens in every 1 out of 10 patients. So if the patient feels dizzy, always have them lay down on the back and do not panic, of course. This is due to the patient being over anxious, over nervous.
좀 어때? 지금은 괜찮아요? 한 3분 정도 끝났고. 네. 그리고 다시 어지러우면 다시 얘기하세요.
I have them lay back for about 3 minutes, and after the patient feels a little better, and have them sit back up. And always, it's important to ask the patient of their current status. If they feel dizzy, have them lay back down for another 3 minutes or so.
좀 어지러울 것 같은데?
괜찮으세요?
어지럽죠?
아까 조금 맞았어요.
조금은
아까
나은데요.
현기증 나서 지금 조금
인사하는 좀 쉬고.
네.
그럼 이쪽만 먼저 하고 끝냅시다. 네, 살짝 그렇게 되시고 편안하게.
So making that punching injection at the site.
지르게 돼요.
The thread has been successfully inserted. Now he's making the cuts. Thread.
어지러우면 얘기하세요.
Constantly talking with the patient. Ask the current status. If they feel dizzy, they're always free to call the doctor.
편안하게, 천천히.
Video threads are an excellent way to give that immediate anchoring position. The cheeks give that immediate lifting effect.
어지러워요. 됐어. 다 했어요.
The thread that Dr. Rowe prefers to use is called TENCOG, which is an asymmetrical PDO thread, which is bidirectional. It's asymmetrical, and therefore it has the best anchoring ratio. See that 2 centimeter hangs up in the temporal area, and then the rest 6 centimeter hangs down.
자, 여기까지 일단 합시다.